John Oxley, CEO of Stockport Active Community Interest Company. Really impressed with what you've done over in the UK, John, and thank you for joining us today on this NSC Insights.
Thank you, Martin. Great to see you.
We're really looking forward to having you over in Melbourne at the end of June. Now, one of the things the UK have done, and especially the work that you're doing in Greater Manchester, is really bringing the health agenda together with community sport and recreation sites and looking at the preventative health and the health promotion impact that sport and leisure can have. Can you just explain roughly what you're doing in that space?
Yeah, certainly, Martin. I mean, it's a response to, in 2010, there was a very famous report scribed by Sir Michael Marmot, which talked about health inequalities, population health, and the social determinants of health. And so we've been working hard, I guess, since then, really to understand why public leisure services exist and make them meaningful and relevant. It's very easy to deliver services for those who are already motivated to exercise and be fit, and we can sometimes be criticized for simply encouraging the fit to become fitter.
Yes.
But actually, population health matters to everybody, and local government services in leisure, it's a non-statutory service, so our ability to be meaningful and relevant is critical. And what we're doing now is responding to the needs of population health and the situation around deepening health inequalities, and trying to address those so that our efforts, everybody should have the right to be healthy and to move about and be able to move about. And we're trying to define or redesign activity back into everyday life.
Brilliant. That sounds really quite exciting, challenging, but really quite exciting if you can get those outcomes. Now, two of your compatriots who are speaking at the keynote is Dr. Henry Bernard Baptiste, who's the director at the Mauritius Sports Council, and he's actually a GP as well. So he actually has understood how to connect participation with the health benefits, both economically and socially. And we've also got Michelle Murray, who's the executive manager of Vic Health, which is our health promotion agency. How has Stockport looked at the health outcomes and how you measure health outcomes in the local community?
Well, a couple of ways, really, Martin. Number one, we've established over a number of years what we call a specialist physical activity service. And that employs trained wellbeing coaches and takes on referrals from clinicians, but also takes on referrals from members of the public who wish to self-refer if they've got a long-term health condition. So we've got a criteria around long-term health conditions. If they've got those, then they can come onto the scheme. And that scheme delivers services. We're commissioned by Public Health to deliver a scheme for 1,500 people. We're oversubscribed. We've got 2,500 people enjoying those services that make a difference to their lives. And people come with predominantly, increasingly mental health and well-being issues, but also MSK, arthritic joint conditions, and we deliver a program and measure the outcomes. So we take a baseline measure at the start of the intervention, and we take another measure after 6 months. We use EQ5D and WEMWEBs, which are rigorous educationally supported outcome measures. And we've just had an evaluation actually on the social value. So that measures sort of well-being, but we've also had a socioeconomic value done on the scheme, which has delivered some outstanding results, which I'm going to share with people in Melbourne in a couple of months' time.
Well, we're really looking forward to you coming over, John, and I think your session will be well attended because the health agenda is so critical for local government and the local communities. So thanks for joining us today for this quick synopsis, and we look forward to seeing you at the end of June in Melbourne. Thanks, mate.
You're most welcome. Look forward to it, Martin.